Welcome to our channel, where we delve into various health topics to keep you informed and educated. Today, we'll be discussing murine typhus, an infectious disease caused by the bacterium Rickettsia typhi. This illness might not be one that you hear about often, but understanding its origins, symptoms, transmission, and prevention is crucial for anyone, especially those living in endemic areas. Murine typhus is primarily transmitted by fleas, specifically the fleas that infest rats. These fleas carry the bacteria, and when they bite humans, they can transmit the infection. The disease is sometimes referred to as flea-borne typhus because of this transmission route. Of note, humans can also be infected through contact with infected flea feces. This occurs when the feces are scratched or damaged skin or through respiratory droplets if the feces become aerosolized. Murine typhus is particularly common in areas with poor sanitation and overcrowded living conditions, often associated with poverty. While it can occur globally, it is more prevalent in tropical and subtropical regions. Historical outbreaks have been noted in urban settings where rat populations thrive. After the bite or contact, symptoms typically develop within 1 to 2 weeks. The initial signs mirror flu-like symptoms, including fever, headache, chills, and malaise. As the illness progresses, many individuals may develop a characteristic rash that usually starts on the trunk and spreads to the extremities, but it often spares the face, palms, and soles. Other symptoms can include gastrointestinal issues such as nausea, vomiting, and abdominal pain, as well as muscle pain or strength loss. In some cases, patients may experience confusion or delirium if the disease progresses and is left untreated. Now, how is murine typhus diagnosed? Healthcare providers typically take into account clinical history, symptoms, and exposure risk. Laboratory tests can confirm the diagnosis by detecting antibodies against Rickettsia typhi or identifying the bacteria through polymerase chain reaction testing. Prompt diagnosis is essential, as untreated murine typhus can lead to complications, such as kidney failure or respiratory distress. Fortunately, murine typhus is effectively treatable with antibiotics. Doxycycline is the first-line treatment and is generally administered for 7 to 14 days, depending on the severity of the infection. Most individuals respond well to treatment, and hospitalizations are rare. With appropriate medical care, the prognosis is excellent, and most patients recover without long-term effects. The key to preventing murine typhus lies in controlling rat populations and flea infestations. Keeping living areas clean, reducing clutter, and sealing up potential entry points for rodents can go a long way in minimizing risk. If you live in an area where murine typhus is prevalent, it's wise to take extra precautions, such as using flea control products on pets, ensuring proper sanitation, and being cautious when handling or coming into contact with areas known for rodent activity. In conclusion, while murine typhus may not be at the forefront of public health discussions, it poses a significant risk in certain environments. Awareness of the risk factors and symptoms can lead to early detection and treatment, thereby improving outcomes. We encourage you to share this information and spread awareness about murine typhus, because knowledge can empower communities and help reduce the incidence of this disease. Thank you for joining us today to learn about murine typhus. If you found this video informative, please like, subscribe, and turn on notifications for more educational content. Stay safe and healthy. And remember that keeping informed is one of the best ways to protect yourself and your community from infectious diseases.